Welcome everybody to an unscheduled live stream. Today, the reason why I'm doing an unscheduled live stream, this is not part of our normal live streams, weekly live streams. I'll be having one on Sunday as normal. Uh, I always try to have one every Sunday, but we did do a live stream on the topic of healthcare here in Mexico. I know a lot of people had a lot of questions, and the reason why I decided to do a live stream is because I've been in Monterrey. If any of you all don't know, those of you who are joining or new to the channel, I live in San Miguel de Allende, but I also have a house in Monterrey, Mexico, and we commute back and forth. And one of the reasons why I live in Monterrey, apart from family, my in-laws live here, and apart from that, I also do all my medical stuff here. If you've seen any of my videos, you'll know that I was actually treated for cancer here in Mexico. Unfortunately, the U.S. Hey, Stephanie, how are you doing? And Denise and Cindy, how are you guys doing? Thank you for joining us. But I was treated for cancer because the U.S. healthcare system failed me. And we're going to, excuse me, I'm sorry about that, but we're going to go over that. But one of the reasons why I decided to do this live stream is because every time we come here to Monterrey, I'm going to be doing my 5-year PET scan, my last PET scan now in a week. But I wanted to get everybody, we're doing all of our medical checkups and all our specialists and everything. We have them here in Monterrey. So yesterday, my wife went in for some female studies that she needed to do, and routine studies. And I looked at the bill, and we always talk about, oh, it's very expensive, healthcare insurance, all of that stuff. And I kind of got motivated to go ahead and do this live stream because when I looked at the bill, I'm like, wow, this is actually affordable. Not maybe affordable if you're on a limited budget, but there may be a way. I kind of started thinking, a lot of people that come here that are on Medicare. Hey, Gringos Are Us. Hey, Kai. A lot of people that come here on Medicare say, well, what's my options? And then we were talking about in my last live stream about IMSS, but it's very hard to get onto IMSS. If you're even taking cholesterol medication, it's hard to get onto IMSS. Some people have been lucky that they just do blood work and they got on IMSS. Some people can't. I told people about the drawbacks of IMSS. And then you have the private healthcare insurance. They can get exorbitantly expensive as you get older. And that's even if you meet the age limit, if you're coming as an older person here, above 65 or 67. I do know some will do up to 73, I believe. I'm not even sure. But 67 with my insurance agent is a cutoff for even getting insurance. Hey, Daniel, how's it going? And jet lag, welcome. Rick, Joyce, welcome. How's it going? So what I was thinking is, well, I kind of made healthcare seem kind of cost prohibitive here, right? If you don't have insurance, well, what am I going to do if I don't have insurance? And if I'm on Medicare, Medicare doesn't cover me in Mexico. And what if I can't get an IMSS? And what if I have pre-existing conditions that I don't qualify for private insurance, even if I can afford it? Well, I got this bill yesterday, and, I pay the bills and I get reimbursed from my U.S. insurance, and we're going to go over that too. So I don't really pay attention. I pay attention in the sense that it has to come out of my pocket and I have to pay the bill and then I have to submit the claim and I have to get my money back. But I really wasn't thinking. I just took the bill and I'd pay it. And I mentioned this before in my cancer video, how exorbitantly cheaper it is here in Mexico to do certain procedures, to do anything. And yes, I know I'm talking about my surgery. My surgery for cancer cost $8,000. Now, a lot of people are going to say, I don't have $8,000. But here's the good news. this is a surgery, and not the good news, but this is what I want to compare it to. I spent 3 days in the hospital. If I would have done this same surgery, number one, they probably would have closed me up and never discovered the cancer because my doctor was very observant. And normally that's not a protocol that my doctor went outside of protocol. And second of all, I probably would have spent, well, my insurance would have been charged probably 5 to 6 times as much as that $8,000. So that kind of brings me down to why I decided to do this stream, because there might be some alternatives for you if you want to move to Mexico. And let's say you have Medicare, or let's say you have US insurance, but it doesn't cover you in Mexico. You might have some alternatives here. And one of the alternatives that, first of all, basic medical care, for example, you have a cold, the flu, COVID, for example, you can go, there's a family practice doctor is going to usually charge you, depending on where you go, it's going to be $20 for a visit or $15 for a visit. And also, if you take certain medications that are maybe controlled, you can get most of your medication over the counter here, but there are certain medications that are controlled that you need a prescription for. And there's a doctor in the pharmacy right next door, and you tip them $10 or $15 if you need to get your medications. So, medication is very accessible here, very inexpensive, but you might say, what's going to happen to me if I don't know, need a heart surgery, or I need something like that? I go to the cardiologist. I have a condition that needs to be monitored. I get a stress test every year. But here's an option that I'm just going to throw out there, but I'm also going to let you know that medical care can be cost prohibitive in the sense of being on a limited budget, but at the same time, it may not be that bad as we put it out to be, because you can't get insurance or you can't get an IMSS. The first thing that I'm going to do is and actually Gringos Are Us. Before that, we did our own COVID treatment, and it cost a mere pittance compared to what we would have dealt with back in the USA. Exactly, Gringos Are Us. But what I'm going to do, I brought, and I'm not going to show you the whole thing, but this is the receipt for some studies that my wife did. And they're normal, not gynecological studies, but female studies. For example, she had a mammogram, and the price of the mammogram, and excuse me, I'm going to take out my trusty iPhone with the converter. And that mammogram came out to 1,293 pesos. So if I convert that at today's exchange rate, her mammogram, and also the mammogram was not just a mammogram, it was also with an echo. They had to go in with the echo machine, cost her $75. $75. That's what I would have paid out of pocket back in the United States, because my insurance only covers me 90%. If I would have literally had to pay more than the $75 out of my own pocket if I would have done this in the United States. Okay, the next thing that she did was an echo on her pelvis, which was $1,667.37. That was $97. Hey, Retribution, great to see you. That was $97. So just think of this: $75 for the mammogram, $97 for the pelvis, and then she did an MRI. Now think about it this way: it's a TAC, it's an MRI to determine bone density. Okay, this TAC or MRI was 1,487 pesos, which equals $86. $86. So let me ask you as the audience, do you think you could have gotten that done for $86 without insurance? Because remember, I have to pay out of pocket. Now, I do get reimbursed, but I have to pay out of pocket. Now, the total was $3,344.09. And this was at a private hospital, $195 for all of these studies. Okay. This was at a private hospital, one of the best hospitals here in Monterrey. Not at the public healthcare hospital, not at public healthcare. It was at a private hospital. Okay. So, and then Gringos Are Us. I'm gonna bring their comment up. We also did our lab test and ran us about $65 US dollars each. Comprehensive testing, very quick results. Not only do they give you very quick results, but you own your own results. They even give you a website where you can go back onto the website and you can pull up your results, and they'll send your results to your doctor. And if you do it at the same lab, I have all my results and all the record of my results in that lab so they can pull it up. Same thing with my wife. When she did this study, they had in their database already computerized. And the hospital she went to was Christus Muguerza. I don't know if many of you, I do know there's a Christus. It's a hospital corporation that's worldwide. Christus has, I do know they have them in New Mexico, but it's a Christus hospital. So you're not going to some no-name brand hospital. This is a corporation that's worldwide. And they have her records in the database. They were able to compare her last tests with these tests right off the bat, right there while they were doing the test. Not at a doctor's visit, not at a, let me see no, this was right there. So the radiologist was able to make a diagnosis based on her last test and this test. So this is pretty good stuff. $195, literally I would have paid more out of pocket, or if I would have had my deductible, I would have paid the whole amount out of pocket, up to $350 for her, because that's her deductible. And that's not including the 90% in the U.S. Can you imagine what I would have paid out of pocket in the U.S. with insurance? With insurance, I would have paid more money. So I wanted to give people, here's Mark Larkey, Mal Larkey. Welcome to the live stream. Mal Larkey, $20,000 for my ER visit for a kidney stone in the U.S. Paid up front, discounted to $8,000. Yeah, that's $8,000. I got major surgery for $8,000 here. And I mean, I know not all of us have $8,000. It's not all of us have $8,000 to shell out, but here's where I'm going. Also, Denise, I just paid $1,800 US dollars per year for major medical with a $5,000 deductible for illness. Not bad. Pay about $300 US for all my annual tests, labs, and doctor's visit. The care here is superb. Yes, Denise. And actually, that $5,000 deductible, I have to meet a $700 deductible between the both of us, or $350 each, for every year. It doesn't matter per condition. What Denise was saying right now is she has to pay $5,000 per illness. So, for example, let's say I get a heart attack. I have a Mexican policy, mostly because I can still afford it, and it hasn't gotten too expensive. Let's say I get a heart attack. I go to the hospital. I get open heart surgery. Okay. And this is really why I have it. I have it just for extra security, on my own security, sense of security. And I go and I have an open heart surgery. I pay that $5,000 deductible, but after that, anything related to my heart, if I have to get another open heart surgery, if they have to open me up again, if they have to do 3 surgeries, I don't pay a deductible. That's the way the insurance works here. I just thought I would point that out. Stephanie, while I was in San Miguel recently, I had an ERA stress test and appointments with an internal medicine doctor was about $500 total. And these are examples where if you can save a little bit of money, if you can have a savings account, okay, maybe this is an option for you. Be able to pay some of these things up front. Oh, you know what? I'm feeling, let's say, I don't know, I have to do my annual stress test. I do my annual stress test. My stress test costs me, I don't know, I don't know if it's going to go up any, how much it's going to go up. And I'm not sure if it's going to go up, but my stress test is about $200 every year. Let's say my stress test comes out bad. Let's say I'm on Medicare. I roll home, get what I need done. They're back in the United States. That is an option. Being able to do your regular preventative health care here and then just run to the States if you have insurance there that you're not covered here, or you don't have the money to do it here. Or maybe you might have a nice little savings account of $10,000 where you can actually do the procedure here. And my wife was just pointing out, not just that, I was able to schedule those tests for the next day. Literally, and I'll give you the background, is that we went to the endocrinologist, and the endocrinologist looked at her blood work and said, you know what? When was the last time you did all of these studies? And she said, oh, well, I did them a year ago or whatever. And well, you need to do them every year. So I would suggest these studies. Also, I need to discount a couple of things that I'm seeing here. So why don't you go get these studies? I mean, they're normal studies that you do every year. She still needs to do them. She literally walked out of the doctor's office. We had the appointment at 11 o'clock. We went to lunch. We scheduled the appointment at 3 o'clock by the time we got home and everything else, we had him schedule the appointment. We were on the phone at 3 o'clock and we were in the hospital the following morning at 10 o'clock in the morning to do the test. Not only that, but she did the test at 11 o'clock in the morning. And by 3 o'clock in the afternoon, we were logging on to the website for the hospital and looking at her results. And I was able to download her results. Tomorrow, she's going to go to another doctor, which she was able to schedule from today to tomorrow. And she's going to go to that other doctor. And we have a thumb drive with all the results. No, we don't have to get authorization from the other doctor that did it. We don't have to get permission from the hospital. We own our results. I have it on a thumb drive. We read the results of our test last night. So this is something that you might want to look at. And, or maybe you have a credit card with a high limit that you there's a catastrophic emergency that you can do that. So, and you know what? Another example, we went to Cancun. We've had, not Cancun, in Cozumel. And this is a tourist area where they charge more, take into consideration. And we've had twice to go to the emergency room, once for my son and once for my wife. And the emergency room didn't actually charge more than like $50 each time for minor things. The last time I went to an emergency room in the United States, I got a bill from an emergency room doctor for $3,000 for a normal thing that I went in. They said, you're okay. I got a bill for $3,000. And then I said, well, wait a second. I went to a preferred hospital. I'm only supposed to pay the $200 to get into the emergency room. Oh, no, we're contract doctors and we're not on your preferred providers. So you need to pay us $2,000. That is a true story. And I didn't pay the $2,000 because I had to fight with the insurance company. And it took me 6 months to get the insurance company to pay the ER doctor. So these are things that the U.S. system has failed me. But I just thought I'd bring it, Stephanie. Luckily, because of ending up in the ER, I overstayed my FMN. So I was able to get my residency. Yep, you got the regularization. That's awesome. The regularization is a good way to go. I'm telling you right now, if you can do it, and I do know that according to Sonia Diaz, certain airports, if you fly in, you can actually ask for less than 180 days. Most of the time, they will give you 180 days. And here's another thing. I don't know if it's still happening on the land border, but when we used to visit, there used to be, well, when you fly in, you pay a tourist fee. That's really paying your FMM. But when you drive in, and actually, if you get less than 180 days or you only get 7 days, you can get that money refunded from the airline. We've talked about this before. But when you come in on the land borders, if you say, I want the free FMM, which is 14 days, I believe, 7 or 14 days, they will give you the 14 days. If you want more than that, then you have to pay the 200 or 300 pesos. I don't know what the rate is now. So that's maybe a way you can get a shorter FMM. And I know that Sonia Diaz said, I think the Leon airports, several airports are letting people request less days than they need. And then go get with them and do the regularization program. But I haven't touched, Malarkey, I haven't touched my retirement. It is my medical emergency money, LOL. Live frugally on my Social Security. Mal, I just did a video on living, cost of living, and you are a perfect example. Like I said, you live frugally, enjoy Mexico. There you can make your budget the way you want to make it, and you're a perfect example of how planning is key. You have that retirement fund. If you need to go to the hospital, you have something, and I'm almost sure you have some plans if you need to go back to the States under whatever. But Sinikawa, yep, tests that quick don't happen here in the state. And actually, they don't. Let me give you the story of my cancer, Cindy. And actually, I got a comment on my cancer video. Someone, a Hispanic, was saying that, oh, well, the rich people don't go to the hospitals there in Mexico because they don't trust the healthcare system. And he was talking about MD Anderson. And usually the rich people go to MD Anderson because I made a comment about MD Anderson. And he said, and I lost a friend to cancer there. Well, first of all, one of the things that I pointed out is you didn't tell me where you lost your friend. If it was in the public healthcare system, I can understand, because depending on what level of public healthcare you have, maybe your friend had to wait for whatever surgery, whatever treatment. If he would have been treated in the private healthcare system, trust me, I literally got, like on my cancer, I literally called the doctor. I was on the road the next day, and I was actually seeing him the following day. He was even actually offering me an appointment the next day, and I was like, well, wait a second, I need to drive from McAllen, Texas. Another thing, Cindy, that I would like to remind everybody is that my insurance company was still fighting with my original family doctor to give me the MRI I needed to move forward, to do anything, to do surgery or anything else. And the doctor already had me on the table, was operating on me, discovered the cancer. And when I called my insurance company, just by chance, do you think you might be able to cover me? And they said, oh yeah, send us a bill. The ironic thing is that my insurance company had no problem paying the $8,000 bill, my MRI bill, and they still were fighting with my family and was still pending pre-approval for an MRI in the United States 6 months later. That goes to show you how the system failed me. And as I was talking about where I got treated at one of the best hospitals in all of Mexico. There are several. As a matter of fact, I was just reading an article about the top places to get treated in Mexico are Mexico City, Guadalajara, and Monterrey. Those are the top three for hospitals and doctors and everything else. And like I even pointed out in my video, and I pointed out to this guy, one of the hospitals here in Monterrey is so world famous, they had a radiation machine that not even MD Anderson had. So and it's a common machine now, and MD Anderson has it and everybody has it, but they were only one of 7 locations that was given this machine to test it out. So that gives you the quality of healthcare here. Not only that, but I will inform you that yes, the wealthy do sometimes go to the United States. The wealthy do send their kids to school in the United States, probably more to learn English than anything else. But the rich of the rich, the true rich, the Carlos Slim is not going to go to a doctor in the United States. Carlos Slim is going to go to one of the hospitals that I went to. The Carlos Slim is one of the richest people in the world. And I trust me, he will not go to, and if he has to go anywhere else, he'll go to France or another country, but he gets treated here in Mexico at the best hospitals. And so anybody that tells you that hospital care here is, and you know what, even public hospital care, yes, you don't have a private room. Yes, you need a family member there with IMSS. But just remember, some of these world famous doctors actually work in private practice too, and they do both public practice and private practice. So you may go in on the public healthcare system and you may get brain surgery from one of the best neurosurgeons in the world. I'm not talking, some of these doctors are world renowned. Actually, he's practicing in the United States, but one of the most well-renowned surgeons in all of the world, he practices in the United States. He's from Mexico. And actually, I saw a documentary on him, and he used to talk about how you used to jump the fence to come into the United States illegally. So I can tell you right now, healthcare here is 1,000 times better. And you know what? I'm not putting down the United States. They have a lot of technology, probably the most cutting edge technology. But the problem is the bureaucracy, the insurance company, the doctors, the lawsuits, all of that stuff equals no care for the patient. It's all about money. And here it's all about care. Actually, believe it or not, when I go to my endocrinologist, yes, he's giving me medications, but he'll tell me, oh, you know what? You need to control this with diet, or you need to do this, or you need to do that. Not all doctors are going to give you a pill every single time you go there. They're very, very holistic here. That's the way it works. So let's see here. Malarkey. We live in Lake Chapala in a small town, not Gringolandia. I chose to go to Guadalajara for a specialist for my diabetes. Great experience. Visit, EKG, ultrasound, and on my kidneys, visit was 800 pesos. Sounds exactly like that, like exactly what I'm trying to explain here. And I don't know, Mal, if you're on Medicare or whatever, but if you were on Medicare, let's say they found a problem and you could get on a plane and fly back. And I actually know people who do that. They go back once a year to visit their family and get all of their stuff done on their Medicare. So more money can be made in the USA. Doctors from all over the world come here for that one reason. The healthcare is great if you have money and or insurance. With that said, it's about money. Yeah. The only thing, Jay, I will tell you, and let me explain to you, I come from a border area. Where I was seen was in a border area. There's a big misconception. I have a couple of friends that are doctors that I went to school with, I grew up with. Doctors don't make as much money as you think they do. Yes, they do. A lot of them drive around in a BMW. A lot of them own $3 million homes. But I guarantee you that BMW is a business expense. It's probably being leased, okay? And also that $3 million home is on a mortgage. A doctor here in Mexico, his house is paid off. So a doctor here may live a more simple life and have a $300,000 home, but the doctor here owns his house. He owns his BMW outright. Interest rates here are out the roof. So that's one thing. The second thing you need to understand, and I do know also, my ear, nose, and throat doctor even said, if you want to go to the United States, I have a good friend of mine that went to the U.S. He was practicing in San Antonio, Texas. If you want to go there, you can go there. I can give you a referral. But I didn't choose to do that. His friend went there for the money. But that doesn't mean it's the best doctor. Let me explain to you where my doctor studied. My doctor studied at the best university here in Mexico, private university, equivalent to an MIT education in medicine. He did his residency in ear, nose, and throat in Israel. And Israel is very famous for their doctors and their medical care. He came back and did a residency in pediatric in both MIT and Harvard. So to say that doctors that have qualifications all run to the United States, I would argue that's not true. Not all the doctors do. My doctor didn't, and he's the one that saved my life. And he's the one that said, hey, this is weird. I'm going to do something. The other thing that I will explain to you about the insurance thing is I have insurance. I have good insurance. I work for the federal government. I have, as a matter of fact, that's why they cover me overseas. I have full coverage. And the problem that you have in South Texas is that you have a lot of people on Medicaid and Medicare. A lot of people on Medicaid. It's a very economically depressed area. So what happens in South Texas is that my insurance company will pay, I don't know, $120, $200 for a visit, okay? Medicare is only going to, or Medicaid is only going to pay $50 for a visit. So what happens is the doctor that takes Medicare and Medicaid, and down in the valley you have to, because it's the only way to make money, you have to fill your office with 4 patients for every 1 patient that my insurance covers. So what happens is, literally, when I went to my family doctor, we're talking about being in the waiting room anywhere from 4 to 5 hours. I personally knew my family doctor. I had a personal relationship with him, outside. And so I would text him, and that's the only way that I would get in on time, because I would be usually coming from, I'd take time off of work. And he usually knew because I was in law enforcement. He'd like, hey, dude, just text me. I'll take you right away. I'll even put you in my office. I don't need to put you in a room. And so I got special treatment. But let me put it this way. It was not unusual to go into a waiting room with anywhere from 50 to 100 people in that waiting room. Even when my cardiologist, my wife had to wait 4 hours to see a as a matter of fact, my wife left because she has diabetes and her blood sugars were getting low. And 5 hours later, she says, look, my appointment was at 10 o'clock in the morning. It's already 4 o'clock in the afternoon. I haven't even seen the doctor yet. So if you have insurance here, it doesn't really make a difference. In the United States, sometimes it doesn't make a difference. Yes, it does for the person that doesn't have insurance versus the person that does have insurance. But let me put it this way. In South Texas and other parts of the United States, especially more economically depressed or the big cities, you're going to get the same treatment as a person on Medicaid, free healthcare, or Medicare, which is Social Security, as you would get paying premiums to an insurance company. I don't get any special treatment. Here in Mexico, if you have insurance, you get seen. Here in Mexico, when you have an appointment and it's 11:30, you better be there at 11:30 or the doctor won't see you. I have my appointment and I don't go into a room. I see the doctor in his office. He's got all of his examining stuff in his office. So this is just my experience. Now, like I said, I've had that experience because of where I've lived. And Santa Fe, New Mexico, same thing. When I lived there, healthcare isn't. I mean, a lot of people don't. As a matter of fact, there's so many rich people that live in Santa Fe. Doctors don't even take insurance. I had a hard time finding a doctor that would take insurance because guess what? All these rich people paid in cash. So you have to be very careful when you try to say that the USA has this great healthcare system, because I had insurance and I couldn't even find a family doctor. So is that fair? It is all about the money. And I'm not, Jay, I'm not arguing with you, but I'm just bringing you a different perspective. The problem in the USA is that we are always taught that we're number one at everything, and we're number one. And let me tell you something. I'm not discounting it. I gave my life to my country for 30 years. I'm not putting down the United States, but what I'm trying to do is tell people that it's not all roses, especially when it comes to healthcare. Like I said, it failed me, and I had insurance, and I got treated with the same radiation equipment. I got treated by a world-renowned doctor who was the president of the Association for Oncologists out of Paris, France. So I got the best. And working in a hospital not a nurse, but a bottom line is those with insurance cover those who don't pay. Exactly, Al. We're informed 75 of their visits go unpaid. That's true. And that's very true. Yes, Jay, I totally agree with you. The point is money here. I totally agree with you. And I know your point, but I was just bringing out some other things about the healthcare system. Like I said, just don't think I was trying to argue with you or that you thought that USA was better. I know that, I'm just bringing out a different perspective. Because Jay, when someone kind of assumes, when someone assumes that you pay more money, you assume you get better care, right? And I'm paying 40%, 30% of the cost of what it costs in in the United States, out of pocket. This is without insurance, and I'm getting the same level of care. There has to be a problem. And I know you're not attacking Mexico, Jay. I know I'm not. Actually, Jay, I apologize if you feel that I was saying that you're attacking Mexico. The issue that I have, Jay, and let me explain, and the reason, and you'll see me do this a lot in my live streams. Someone will bring something up and I'll elaborate, and that's why I was elaborating a little bit more. It sounded like maybe more I was getting after you, but I try to elaborate on a lot of these points, and I understand. I know a lot of people have to come back and say, no, I didn't mean that. No, I know you didn't mean that. You made a perfect comment, and that gave me the opportunity to explain to the audience that it is about money and how it is about better care here, how it is cheaper here. I know you're not attacking Mexico, and I know, Jay, actually your intention was all the doctors go for the money over there because they make more money. But in reality, do they really make more money? That's the point I was trying to say is I brought this up in the cost of living, which we're going to go over in the next live stream, that someone brought up some statistics. One of the YouTubers brought up a statistics, and he used a doctor, for example, and he used a public health doctor so that it would fit his narrative. And he said, oh, a public health doctor makes $22,000 a year. And he was trying to say that that puts you in the Mexican middle class. And but you have to understand that, yes, 22,000. No, well, first of all, that doctor probably has other businesses, probably makes more than $22,000 a year, probably clears 100 and something between a private practice and something else. That wasn't mentioned in his video. He just said, oh, but be aware he might make money elsewhere. But the other thing that people need to understand is that a middle class lifestyle in the United States is not the same as a middle class lifestyle here. And that's why I brought up that even though these doctors, I guess what they perceive as money, I have a BMW, I have a $3 million home, I have 3 Harleys, and actually 3 Harleys that they can't even ride because they're at the hospital all the time. That doesn't necessarily mean you're better off. The doctor that makes $100,000 a year, owns his own house and his own BMW that he saved up for, if he loses his job tomorrow, he does it, and he pays $300 a year in property taxes, he's better off than the doctor that if he loses his job tomorrow or loses his license tomorrow, he doesn't have a life, unfortunately. So, Jay, don't take this personally. And actually, thank you. I want to thank you for bringing that up because, and I don't want to discourage anybody from, I don't try to argue or whatever. I just try to bring up points, and I try to use these comments to bring up great points. And Jay brought up a great point. It's all about the money, exactly like I said. And you know what? I'm not putting down healthcare in the United States neither. I just suggested if you're on Medicare, do your test here, go back to the States and get it done. You know what? If you can get it done, and you know what? I also have relatives that are in Austin that tell me that in Austin, Texas, that no, well, we don't wait. We maybe an hour. We don't wait 5 hours for an appointment. So it all depends where you're at in the United States. So I'm not putting U.S. healthcare down neither. So Stephanie Beckman, both doctor's appointments were on time and I walked out with my results. Amazing. Yes, you do. You walk out with everything. And actually, sometimes you know your results of your blood test. I mean, you walk in with your results of your blood test. So usually you already kind of have an idea where you're at. My wife read the results. The only thing is sometimes those results can, when you start saying, what does it mean if I'm low in this or low in that? And then all of a sudden you go to the internet and all of a sudden it starts scaring the heck out of you. But you have your own results. Everything, you do everything that day. And I've never had to wait more than 10 minutes for a doctor for my appointment. Actually, when I'm late, I have to call to tell the doctor that I'm late. I have to tell him because if they have another patient and they schedule me and I'm 30 minutes late, but the next patient, no, they'll say, you know what, let's reschedule because you can't make it because you're in traffic, because we have another appointment and we're not going to push that appointment for you to be because you're late. The most important part of healthcare is being accountable for your health care no matter where you live. Be your best advocate. Yes, Mel. And you know what, Mel? A lot of this also comes down to self-care, walking every day, exercising every day. I will tell you one thing too, the advantage to living in Mexico, the food's more organic. My cholesterol, I've never had a better cholesterol levels than I have now. My A1C, even though I'm insulin resistant, my A1C is a 5.3. Never seen that in the United States when I was living there in the United States. Never saw anything below a 5.7. And that's when I was eating, quote, quote, well. That's when I was eating from whole foods. That's when I was eating, quote, quote, organic food. My cholesterol levels were never at the levels they are now. So just living here, eating organic food that comes from the market, that comes straight from the ground, that does the body a wonders. So it's not just about going to the doctor. Like Miles said, it's about well-being and health in general. Yep, I agree, Mal. My doctor said the best insurance is a clean diet and 10,000 steps a day. And that's true. And I'll tell you what, I live in San Miguel de Allende when I'm not living here in Monterrey. Uh, and in San Miguel de Allende, we go and the streets are cobblestone and it's a lot of uphill walking and a lot of downhill walking and a lot of uneven streets. And my wife and I, we get more exercise. As a matter of fact, my Apple Watch, uh, within the first 30 minutes we're in downtown, says that I've already met my exercise goal when I haven't even put my workout on to say that I'm walking. So, and you're going up and down inclines, and that's good naturally for your body. Uh, so, no worries, you're good. I never took it anyway. Not a problem, Jay Gomez. And thank you for that comment. Like I said, it gives me an opportunity to bring out more stuff. Tom, hi, Ernie, and everyone fell in love with Mexico, I guess, and hit my head. I fell in Mexico. I'm not fell in love, fell and hit my head. Went to a private hospital and only cost me about 35 bucks. Same hospital for regular foot care again, outstanding professional care. So this is a perfect example, exactly what I'm coming back with. If you cut your head open, you need stitches, 20 bucks, 30 bucks, 50 bucks, depending. 50 bucks if you're in Cancun or Playa del Carmen, because this is a tourist area. They're ripping you off. 50 bucks is ripping you off. Uh, I'm being sarcastic here. But, 50 bucks, emergency room visit, no problem. I've been in emergency rooms where as a matter of fact, my father, when I was having to take him to the emergency room, they had him in the emergency room in the hallway because they didn't have enough beds to take him upstairs. I mean, we spent the night, 2 days in the emergency room, my dad in a hospital bed in the hallway. So this is the kind of stuff that you run into. Now, does this happen in Mexico? Probably at a public hospital, yes. But if you do private health care, and you can, just like Mal said, is, hey, I have my retirement. If I need something, cool. And like I said, with good planning, you can manage your health care here. And then actually the other thing that I also want to point out is long-term care. This was brought to my attention the last time, and someone wants me to do a video, but I need to look into it a little bit more. But I have in my neighborhood a person from NASA that lives in my neighborhood. He retired from NASA, an older man, and he has a live-in person that lives with him. Actually, her whole family lives with him. They take care of him. And they belong to she belongs to an organization that they try to keep the person at home, sort of like hospice type thing, but quality care. I don't know. I don't know if he pays for the service or if he leaves his inheritance to the organization, but also it benefits the person that's taking care of him because they get free room and board. As a matter of fact, she's even driving around in a Volvo. He bought the Volvo. So for him, if he was in a rest home and his wife passed away, God bless her soul, just recently, about a year ago, and the lady took care of both of them. She's part of the family. Actually, we see her as part of the family. I see the level of care he gets. I'm telling you right now, I have never seen anybody get the level of care and love from this person that you would never find at a rest home. And so it's affordable even in your old age, and you need somebody to help. Now it may be more expensive if you're on remember, I understand people are on a limited budget, but maybe you can make that limited budget kind of stretch if you kind of plan. Gringos are us. But oh, so true. We're in Playa del Carmen, and it's so expensive here. Yeah, it is. It's the tourist prices, and but I bet you anything gringos or us is still more affordable than the United States. um, Deanna J, I saw a dentist for a question. I became a consultation for 50 pesos, included a prescription since I was about to travel. Very grateful. A dental work and here, oh, and Deanna, my experiences with medical care in Mexico, it is that the staff are very well trained and lower prices. Yes. And personalized service. Literally, my endocrinologist, he told me, hey, take some of these. I need some extra blood tests that you forgot to take. Just send them to me WhatsApp. And I'll just tell you if I need to adjust your medication. I don't have to go in for another appointment. I have his WhatsApp number, and he responds to me quickly. Every single one of my specialists, I have a WhatsApp number, and I can actually directly text him. And most of them, I'm very well educated, no English. So if I need to, if I'm really struggling with my Spanish, my wife tells me just write it in English. She'll understand. And even my consultations, it's funny because some of my doctors like to speak English just to practice, knowing that I'm American, even though and I'll speak Spanish back to him, but they'll speak English to me, knowing that I'm from the United States because they like to practice their Spanish. I mean, their English. And the dental work, I get a cleaning, full cleaning. Every 6 months, $50, not even $50. And Monterrey is expensive too, a little bit more expensive. But I believe it was $1,000. No, it was about $50 or $60. Yeah. But on the border, you can get it for even cheaper. A root canal that costs several $1,000s is very affordable, a couple $100. It's not like it is in the States. LOL, that would have been $20 of the bill right there. So I think, like I said, now, and the last point I want to make, I want to make it, well, we're at an hour already. I was going to try to make it short, but the last point I want to make is everybody asks me, how do I get my U.S. insurance to cover me? Because everybody's like, that's the first time I've ever heard of it. Well, that was the first time I ever heard of it. If you're a federal employee on a pension from a federal, you're on FERS, what they call FERS or CSRS, and you get insurance benefits through the federal government, more than likely, Blue Cross Blue Shield, GEHA, I have mail handlers, which is Aetna. They will cover you overseas. The only thing is that you need to pay up front, and they reimburse you. Now, I know Blue Cross Blue Shield does do a reimbursement program where they'll direct deposit the money. My sister-in-law works for GM. She has Blue Cross Blue Shield through GM, and she's had some procedures done here. And they've direct deposited the money into her bank account, U.S. bank account. So now I do know not all insurances will cover you, but this is what I did. And this is what I suggest that you do if you have U.S. insurance. Maybe your pension from GM or your pension from the federal government or from the state for that matter. Most of the state pensions, they're HMOs and stuff like that, but it's usually a major company. Call the 1-800 number and tell them, hey, I'm in Mexico. I need a procedure. That's what I did. And I'm just wondering what I have to do to get it covered. And if you do cover it, the worst thing that can happen is they're going to say, sorry, we don't cover it. My insurance told me, send us the bill. And I was like, okay, so what do I need to do? Do I need to send any kind of extra? Do I need to send pre-authorization or the doctor? As a matter of fact, even my doctors have said, I can write a letter and I can have it translated into English if you need it for your insurance. Maybe some insurance will need it. Mine doesn't. Mine doesn't ask any questions. Now, I have had a couple of times where they do have to ask questions because they need to code. For example, when I send them this bill, sorry about that. I accidentally hit one of my buttons on my mixer. But I have to send the bill, and maybe the bill's not itemized enough. So I've had to have my doctor write a letter saying what each procedure was so they could code it, not because they didn't want to pay it, just so they could classify it as something. They can't just pay you. Thank you, Dan. I'll use the horn more often. As a matter of fact, I don't even remember which one it is. But I have to look at my mixer. But like I said, it's they tell me just to send a bill, and I send a bill. I don't just send them the credit card receipt. I send them the itemized thing, and they figure it out. And if they can't figure it out, they just ask me, "Hey, have the doctor write a thing." And in medical terms, what did he do? Oh, I had a procedure done, and he actually wrote the name of it was a laser procedure, non-invasive laser procedure, and he wrote the actual medical term. So when I saw my explanation of benefits, it was actually the procedure. They have to be able to code it. That's the only thing. And here's the other thing too. I have had some issues where, how do we code this? So I have to explain, okay, this is what the doctor did and everything else, so that they can put it under a different code or whatever, or they might need some explanation. I've even had to type up my own. So I thought the taco lady had a new horn. LOL. Well, actually, the horn was so that I can sign off. So thank guys for joining me. And I really appreciate you guys showing up. I figured I'd do this because I saw it right there. I like to do these surprise live stream. I was doing them on vlog style, but I will come up with surprise, even with safety stuff. If I see something that needs to get out now, I'll tonight live stream so we can discuss it. And so this is one of our unscheduled live streams, not a surprise. This was an unscheduled because of my surprises. I just come out where I'm at. I haven't been able to do any surprises lately because I haven't really been anywhere interesting other than doctors and fixing the house. Maybe I might do a surprise from the house and show people where we're at with the house. And thanks for joining me. We will have a live stream on Sunday. Look out for that. And this next topic is going to be, like I said on the video, the cost of living. We're going to go over the cost of living, and we're going to go over specifically how statistics and I guess statistics and perceptions may not actually fit the bill. Unfortunately, and I don't want to put down this YouTuber. He actually does real good research. He's one of the best researchers. He's got over 100,000. He just hit 100,000 subscribers, but unfortunately, he doesn't even live in Mexico anymore. And not only does he not live in Mexico, but trying to use statistics and trying to put something in a box, in a box that you can't really put in a box. It sounds great in a video, but it's really misleading. And that's where I'm going to come and follow up from that video. If you haven't watched it, it's not my last video because I just came up with another video, but it's the one before that on cost of living if you want to catch up. And that's what our next live stream is going to be. We'll talk to you soon. And thanks for joining me. And until next time, we'll see you soon. Stay safe and see you soon.